Hey guys, this is Mitch Trades and welcome back to my channel. Good to see you. Well, I can't see you, but good to have you watch this video. Appreciate you so much. In this video, we're going to be talking about misconceptions of an ICU nurse. So just a brief background. I've been working as a nurse for almost 5 years now, but in between that, I've worked as a med-surg nurse, I've worked as a trauma ICU nurse, and I currently work as an emergency department nurse. I worked as an ICU nurse for about 2 years. I don't know how that transcends to people who are watching this that have more years than I have, but to me, being that I've had a total of 5 years, 2 years is about 50% of my year span so far. And now I work in the ED, and I can say I see two sides of the coin. Quite an interesting difference, but we will go into it, the misconceptions. So I hear this argument a lot. People think that the ICU is not a fast-paced environment. I think that the workflow in the ICU is different from the ER. And because of that, people use the workflow to determine how much of a pace the work is. I think in the ER, you are physically active, and that does contribute to the fast-paced environment. I'm not saying that the ICU is faster, but I would say that the patients are critically ill, at least the ones that I've taken care of in the hospital that I've been in, because the hospital I've been in is a big hospital, and the patients are pretty sick. Another misconception, which I think should have been the first one that I mentioned, was that people think that ICU nurses have it easy and that they only have 2 patients, so it's not that hard. I would say that I've had shifts where from beginning of shift to the end of shift, I was by my patient's room. One patient alone. I was at that patient's room from beginning of shift to end of shift. The only time I stepped out was and I remember this was at like 4:30 p.m. This was to go use the bathroom and maybe swallow a little bit of food, which happened under like 15 minutes, and I had to go back. And this is, I honestly think depending on the hospital you're working in, if it's a very small hospital, maybe the patients you're seeing are not the sickest, but where I worked, if you go to bigger hospitals in the bigger cities, in the inner cities, and honestly, just everywhere around, sometimes you're going to see patients that are so sick that you can't leave their site for 12 hours. And that's just one patient. Sometimes when I have 2 patients, I am at their room back and forth, going from one room, going to the other room, going from one room, like, it's not easy. I'm just going to say that. So the third misconception is that ICU nurses are very anal and OCD. I don't even use the term anal, but that's what I heard. I would say we are very attentive to detail, so I do see how that can come off as quote-unquote OCD. We are very attentive to detail. We are very organized. We like to keep things at one spot and go and come back and it still be there. But I understand, because the intricacies of the intensive care unit require you to be attentive to detail, because one little thing can mess up the entire thing. That's how attentive to detail you have to be as an ICU nurse. Yes, that's a misconception, because the way it's stated is almost like in a negative connotation, but it's required that as an ICU nurse you are quote-unquote OCD. Another misconception, this is something I heard while I was working in the ED during orientation, was that ICU nurses don't know how to talk to patients. And I think that's because most patients in the ICU are sedated and intubated, where you don't require talking to them much. And once they get extubated, meaning when they have the tube out of their mouth, the tube that's breathing for them, once it's taken out and they're more awake and they're talkative, we normally send them down to a step-down ICU or like a regular med-surg floor. So because of that, people assume that nurses don't know how to talk to patients, which I see where they're coming from. I don't think it's entirely true, because we do have ICU patients that are still awake and they're not sedated under any medications. However, they're still very sick, so we still have to talk to them. And also, being that the patients are very sick, they have lots of family members who come in who need to be consoled, who have no idea what's going on and need to be, talked to about what's going on. So it does still require communication. It does still require communication from nurses, but mostly it's not the patient is the patient's family. The fifth one, which I think is pretty funny, is that the misconception is that ICU nurses think that they're better than other nurses. That one, I'm not gonna lie, I have seen that happen in real life where ICU nurses are snobby and they look down on other nurses. I've been through the trenches. I've been a med-surg nurse. I've been at the other side of things, and I know what it feels like to be looked down upon by other nurses, especially when I first started as a new grad nurse. So I know that feeling, and I can say that yes, some ICU nurses do think that they're better than other nurses. I don't even know how to like defend that, because in their defense, it's almost like they have so much knowledge working in the ICU. They work so closely with the doctors. They have so much skill set that some other specialty nurses might not have, and because of that they feel like they're better. I think people flaunt their knowledge on other people and can be condescending, but what I've learned in this life, I'm not taking no nonsense from people. So I wouldn't let anyone talk down on me regardless of what their nursing specialty is. We're all here for the same goal, which is to take care of people. So in no way, shape, or form you're going to disrespect me. And if anyone comes across me like that, I'm gonna give it to them just like that. So another misconception is that ICU nurses baby their patients. And I have heard this a lot, like when patients move from the ICU over to like a step down unit or a med-surg floor, they're kind of like discontent with the attention that is given to them because they felt like when they're in the ICU, they were given so much attention. The thing is that in the ICU, patients are critically sick, so they do require your attention because you are watching them closely, like every couple minutes to every hour you're watching them, making sure everything is getting better and not declining. And patients correlate that to attention, and they think that it's required like when they go to like a less acuity floor, which is not the case. I think that's something that just has to be educated to patients. I would say yes, we do baby our patients in the sense that we are so overprotective of them. We do try our best to take care of them the best that we can, but that's because they're very, very sick and unstable, and any little thing, like I mentioned, can cause a huge harm. So another misconception is that all ICU nurses want to be CRNAs. I can't even argue with that, because a lot of ICU nurses I've spoken to went into ICU wanting to be a CRNA. Now, did they end up being CRNAs? That's another story, but yes, a lot of nurses do come into the ICU with plans to be a CRNA. And I think, when I started working in the ICU, I was given that prejudgment because I was a young nurse. They're like, oh yeah, she just want to be an ICU nurse for a couple years and leave and be a CRNA. So should I call that a misconception, or just more so like a myth? Maybe a myth that's true. Yeah. And then I hear this like other misconception that ICU nurses are overall annoying. I think passion can be manifested differently in people. People can be passionate about that and something and be super happy. People can be passionate about something and be super dismissive. People can be passionate about something, be very, very micromanaging. So I think ICU nurses, we do have this I don't want to say innate, but we have this desire to want to know everything about a patient. We want to know every single thing because, like I said, we're very attentive to detail, and sometimes that can come off as very annoying, especially when receiving handoff report, I would say, from other nurses from different units. We tend to ask a lot of questions, and it can come off as annoying. But I think for me, I've been fortunate enough to be able to understand the different skill sets of different units and nurses. So it's not that I don't require much or expect much from different units, but it's like, if you know what their scope of practice is and what their limitations are and what their workflow is, maybe it will help you in better communicating with other nurses. So for example, if I'm an ICU nurse, I'm receiving the patient from a nurse that works in a med-surg unit. Being that I've worked there, I know that they don't deal with sedatives, they don't deal with, different specific things. They don't deal with sedatives as much, they don't deal with cardiac medications like vasopressors. They don't deal with like having to understand the maps or like trending medications based on the maps of the patient. So I wouldn't ask them questions like, okay, what's their map goal? What's their pressure? What's their like what medication are they titrated on, or just some like weird stuff. Like I wouldn't do that. There are different, you know, key terms specific to the units, and I think that people have to be understanding that certain units don't use certain skill sets as often as you might. So just read the room. I think that's really the honest thing. Just read the room. And that's pretty much it. If you guys have any other myths or misconceptions about ICU nurses, feel free to put them in the comment section and we'll have a dialogue about it. I think these are the only ones that I could come up with. I don't remember much, but these are all that I can come up with. Thank you guys for watching this video. Feel free to like, comment, and subscribe, and share with a friend. I love you guys so much. I'll see you in my next video.